that we're all going to be a patient one day. So let's learn how to be a patient.
A lot of times it's really just things that you're doing or not doing.
Sleep hygiene really means you're going to go to sleep around the same time every night, and you're going to get to a sleep habit or ritual.
Maybe it was too much caffeine. Maybe it's like, hey, I've been eating too much crappy food.
First time you meet your provider should not be when, oh shit, something went wrong and I need to find somebody to take care of this. What up, our peeps? Welcome back to What the Health Podcast.
Hey, everybody. I'm Dr. Ted Naiman.
I'm Dr. Greg Naiman.
All right. So today's topic, we're going to be talking about the 30s. And we're the 30s decade where everybody is always either broke, they're busy, or they're burnt out.
Yeah. Boy, that was us in 30s, dude.
Right.
Just
for sure.
Out of residency and starting up practice. Yeah. Definitely felt that broke, busy, and burnt out.
Yeah, boy, it takes me back. I mean, the time range where it's like, yeah, you're still got a bunch of, college or med school debt. you're probably, trying to getting more serious in your relationship.
More full. You got, again, sleep starting to get hacked, and you haven't really set the habits yet, and you're burning, the candle both ends. Your diet's all out of whack.
Sure. Because if you think about it, like, that's really the time. So like, hey, 20s are still like, you got a lot of stuff going on. You're still trying to figure stuff out. But like 30s are like, okay, now I'm got like, career, maybe marriage or in a serious relationship, maybe got some kids.
Let's talk about how do people thrive in their 30s.
All right.
So what's the first topic? What do we want to tackle first, bro?
Well, so I feel like probably some of the biggest things that will happen is like people start to get really stressed out. They start getting, all the anxiety, stress. They start to get mentally burnt out. They've got too many things. They're juggling a lot of stuff. They're trying to figure out their career, their social life and all that stuff. So stress and anxiety is a big, huge thing. And it's starting to get that, like, where a lot of people in the 30s start feeling like, well, I'm not maybe as invincible, or I am invincible. I can take on all these things, but then they wind up taking on too much.
Yeah, they don't say no to anything. They keep saying yes to everything, and then it starts piling up. And it's and then when it does, then boy, they start getting stressed out. And when they get stressed out, some of the things that people don't realize is that their body will let them know, but they don't listen to it.
Right.
These are the things where we talk about, like, again, what are the signs that people should be listening to and addressing when it starts happening, so that they don't get into that burnout phase. Because again, it's all about prevention. How do you prevent the burnout when these things happen? The biggest part of it is, well, if you can prevent it by having more structure. Mm-hmm. But we know that, again, this is the age range where you got a lot thrown at you and you're trying to accomplish everything.
Right. So a lot of times, like, so for individuals who are in their 30s, when they're taking on too much and they've got a lot of plates spinning in the air, and they come in and see a health professional, and they'll come oftentimes to us more so with the symptoms of, like, I'm feeling run down, I'm more fatigued, I don't sleep as well, I'm having a hard time sleeping. And then you're kind of like going through all the different things, and hey, I've lost weight, or I'm putting on weight and I can't tell why, or my muscles are aching me, my joints are bothering me, I'm getting bad headaches.
Yeah.
All these things and all these, like, physical ailments and symptoms, and you go through all the different things. So you're like, well, all your labs are normal.
You Google the crap out of it. You're like, hey, what is this? What is this? Man, I'm dying. Everything is, because that's what happens when you're using AI and you're using Google. It's going to tell you all your symptoms are the worst case scenario. So that's happening to you. And you're now going through and you're getting these symptoms. You're getting the symptoms like, I'm having gut issues, and my gut is, and I don't know what it is anymore. And is it a food that I'm not tolerant to? Could I have a food allergy? Am I gluten sensitive and all that? Mm-hmm. It could be that you're stressed out, and again, man, I'm getting all these headaches, and do I have migraines? And it's not in my family history. And now I'm getting these headaches and I'm having all these symptoms. And well, that could be a good sign that you're probably going through some stressors and you're anxious, and it's how your body is coping with it.
Right. So as we talk about psychosomatic, so somatic essentially means like you're having these physical symptoms and ailments. Psycho would mean like it's psychological. So it's one of those where you come in and you've got all these symptoms, and we go chasing all these things down, like, oh, well, they dropped 15 pounds and they don't know why, or they're,
the opposite, they gained it.
Right. They're having bad headaches and they don't know why. They're doing it. We start chasing all these things down. Is it a brain tumor? Is it an aneurysm? Is it, issue with their thyroid or with their growth hormone or their testosterone.
This is 3 pots of coffee that I'm drinking a day.
Right.
And is that could be the reason why I'm having this? And we're like, right, these are all the things that, again, you're starting to have that. Again, take a look in the mirror and really think about, again, is there potentially some areas here where I'm anxious and stressed? And if that's the case, come in, talk to somebody, create a friend group you can communicate with that you can discuss that with.
Sure. And when it comes to mental health, which a lot of times that's the stuff that starts to build up, and we go through all the different things of trying to make sure that there isn't anything else going on with you physically, meaning it isn't a hormone level, it isn't some kind of like crazy like cancer or some other serious blood disorder. And then we come upon like maybe it's more just a mental health issue and maybe you're taking on too much. And that's the part that sometimes gets a little more challenging as physicians is like, well, I can't get you to stop doing all this stuff, like you've got life and you need to manage your, how you like what's important to you in life. Whether it's a, relationship or whether it's work or you've got like 15 plates spinning in the air. But I can tell you that like, hey, it wasn't your thyroid, it wasn't your blood sugar, it wasn't some hormone-based something.
All the rule outs,
right.
It's not that. So then now we understand it is stress and anxiety. So I think we tackled that pretty good.
Mm-hmm.
Maybe we can move on to something else in terms of like what else we see at this age range. And one of the other big things that we see that kind of correlates with stress and anxiety is it starts impacting how they sleep.
Yeah, for sure. So it still kind of still goes into like, 30s generally, it's not enough time unless you've got some genetically, you're just screwed where you've got some serious health issue going on. A lot of times it's really just things that you're doing or not doing. And the things that you're doing is you're taking on too much. And the things you're not doing is making sure you're getting proper rest, sleeping well, getting the proper nutrition, and doing all the things that you should be doing that you're not. And that's when it starts to kind of catch up to you.
Yeah. And we see too that like, we know that, again, sleep is a big factor at this age range. And when we talk about sleep at this age range, it's because, again, they are so busy and they have so many things going on. And again, you get, when I'm still hanging out with friends or I just started my family life and my professional life is starting to really kick off now and I want to get that promotion. I want to start doing those other things or I need to move past a certain point because I have a household income has to go up and you're feeling those financial stressors and that impacts sleep. Because again, at some point, what we see very frequently is then that sleep is the thing that people always kind of cuss.
Tells me, Doc, should I just be pounding melatonin all day?
Yeah. Again, it goes back to the whole thing of people want to rely on something else. And how do I get without having sleep? Can I function on 4 hours? I hear that all the time. And you're like, that's not the way your body was designed. You got to get the recovery. Otherwise, those things that we talked about earlier, the stressors and the psychosomatic issues where the body's starting to portray the stress, you're going to then start having that more and more because you didn't get the recovery rest. Don't cut back on your recovery sleep, and that's going to, you're going to feel it.
Sure. I always say, go back to the, straightforward, wholesome, get up the same time every day. Make sure that you're getting exercise in. Make sure you're eating well. You're avoiding things like caffeine too late because that's going to all keep you up and that's going to disrupt your sleep pattern, which then is just going to carry over. You're just going to go in this vicious cycle of like, I don't sleep well. I'm not eating well. I'm not exercising like I should. I'm chasing down my career or I've got a lot of relationship stuff going on, all these different things. I've got the kids.
So let's talk about that. So again, sleep hygiene, that's the technical term out there. For those who don't know, you'll hear about it. You'll read about it. When you look into this, it's sleep hygiene. Sleep hygiene really means essentially that you're going to go to sleep around the same time every night and you're going to get to a sleep habit or ritual. Before you go to sleep, again, you want to unplug. You want to get rid of anything that's electronic devices, again, anything that's going to stimulate the brain. You want to start maybe reading. And when we're talking reading, we're talking print reading is going to be the best thing. Low lighting. You're going to want to make sure, again, you have a habit of like mindfulness and some of the things to kind of calm the brain down a little bit and get ready for sleep and then get those things. And like you mentioned, probably a good time for you to exercise and wake your body up or your brain up. This is a good time for you to start settling down. That's sleep hygiene. Right. So I think we covered that pretty good. Probably a good time.
When you say for guys when they're going to sleep and exercise their brain, what brain are you talking about?
All right. The one up here, your head up here. So yeah, the brain supposed to be thinking with.
Right. So maybe a good segue to talk about the next topic and go out to some other stuff.
Let's talk about another area that we see in this era is going to be now still back into lifestyle. We talked about sleep. Let's talk about, again, eating, energy, metabolism that we start seeing here, because again, you're right at that cusp at this age range where if you do things right, again, your metabolism shouldn't get too messed up as you age. But if not, then boy, you got to have a lot of recovery that you gotta win back from. So,
and then when we talk about energy, I mean, nutrition and energy almost go hand in hand. So sleep is certainly important, but nutrition and the foods that you're eating certainly make a difference. Maybe we should talk a little bit about like the type of nutrition.
Yeah. So when we talk with patients, when we're discussing energy and energy balance, because that's a big part of the 30s, right? Again, I need my energy. I'm feeling fatigued. I'm feeling run down. All those things that we see. One of the things that we talk about is, right, there's not a work-life balance. It's more energy balance that we really try to coach them on. It's how do we get, because of the lifestyle and all the things that's happening in life right now, you're trying to do all of these things, or you have to do all of these things. This is a good time for us to talk about, it's really your energy balance that you need to get to. We talked about getting good rest. Now we start talking about getting good energy balance because of the exercise that you're doing, the stress you're going through at work, compared to the nutrition that you need to bring in to balance that.
Yeah, and so just to clarify, I think we're saying like energy. Or is it Greg, or is it Dr. Greg, or is it Dr. Mayer? Anyway, so we talk about energy, we're talking about fuel. And so because, some people think of energy to think of like how I feel and like whatever, but when we're talking about energy, we're also talking about fuel. And the type of fuel that you put in your body really matters. Meaning, like, it's really easy to get caught up in I'll just go grab it, at a quick, restaurant or some fast food, whatever, or whatever,
Fast food.
Right. People get things kind of delivered now, whatever. But that being said, if you're not getting the right type of foods in, the right type of energy, the right types of calories, and as a general rule, you're going to want to do things like avoid too much sugar, which essentially translates into carbohydrates.
Simple carbs specifically, sure.
Right. Because all that kind of stuff, if it's like too much, and then the fats, you want to also make sure that you're avoiding high calorie foods as well.
So that your high density foods, but it's also the quality of your food. So when we're talking about your energy expenditure, or you're balancing your energy, just like you said, we do want you to take in at this age range, especially if you're really go at work, life, and everything else. This is probably where you're going to say, is intermittent fasting really the right thing for me? I probably need to have very small, frequent meals, and I'm going to have less simple carbs, but a little bit better balance of carbohydrates you take in. And then, of course, it's going to be the right types of fats. And these are going to be your omegas, really help to support the things that you need. Again, so it's the quality of the fats. It's not your fast foods. It's and avoiding the frieds and all those things, right? The fatty foods, the fried foods. But you do need your omegas at this point. You want to make sure that you're getting the right nutrients at the right time, small, frequent meals to keep your energy balance, and of course the quality of it.
And the meal prepping as well. I mean, I know it's easier to just go grab, food from someplace, whatever, because you're on the go, you got a ton of stuff going on. But meal prepping, meaning, make sure that you're getting the proper portions, you're putting the types of like the macros together. And again, we're not going to get too detailed into the types or whatever, but just make sure you keep the portions down. Make sure you get the proper portions of meals, prepping your meals so that way you're not like having to get stuck with like going out to some restaurant and eating foods that are not, not considered too healthy for you, and because of the fact of probably not exercising as much as well. But I mean, good time to like maybe go into another, like, so then other than you listen to your body when you're maybe not eating like you should, and your body's telling you, hey, I'm not liking what you're doing.
So maybe we transition over now to the next thing that we wanted to discuss is like, okay, if I'm feeling all of these symptoms of anxiety and stress, I'm not getting the sleep I'm supposed to, and my energy balance is not where it's supposed to be. But then I fixed it. I listened to you guys. I went in, I talked to my provider, and they told me all the things. So now I'm fixing it, but I'm still having other symptoms. And again, that goes back to I'm now doing the right stuff. I'm going to the gym. I'm working out, but I'm feeling these aches and pains. Or I'm having still some other things, including, again, still those headaches and what. We want to make sure that, again, at this age range, from a Bayesian perspective, all probability,
right.
Again, we start talking about what are the things that are probable and possible, because we don't want people freaking out, hitting the internet, and then coming back and they're like, hey, I got all of these symptoms. Based off of my symptoms, is this, is that, or I heard this or that. This goes back to, again, probability versus possibility, right?
Sure. and listen to your body. I mean, it's like, I'm a big advocate of the human body is a miraculous machine, and it was built and designed and engineered to, tell you. It doesn't have a barometer, or like, some speedometer, all the other different like metrics on a dashboard, but it does tell you a lot of things that you should, listen to. So if you're like all of a sudden having bad headaches, or if you're all of a sudden like feeling like your joints are achy, your muscles are achy, you're, like maybe you're not recovering from like normal exercise like you used to, or your abdomen is all of a sudden, having aches and pains or things like that. A lot of times it could be, maybe it was too much caffeine. Maybe it's like, hey, I've been eating too much crappy food. And all of a sudden now I'm having indigestion, or I'm like, hey, bad headaches. And it's like, well, maybe it's, taking on too much stress.
Probably a good time for us to discuss again at this age range, when you start having these signs and symptoms, and again, all the probabilities and possibilities, we always go into, again, individuals at this age range, they're not used to coming to the doctor. So we want to make sure that they are coming in and getting consistent care, and getting routine stuff and getting all their baselines. But it's also, when you are coming in because these signs or symptoms, it's a good time to remind patients who are not used to coming in how to be a good patient. And what does that really mean? Because again, it's not like we were born with a how-to book on how to be a patient.
Right.
So, it's a good, from a perspective of like, now you're starting to come in, you have some symptoms. We always talk about it. You want to make sure that you're coming in and you're talking to your provider and you're organizing your thoughts, and then you're trying to do a little bit of homework, write it all down in terms of a symptom started when, and was there anything that was correlating? So you want to kind of chronologically or step by step kind of write it down like you were writing down a whole process of these are the things that were happening.
Right.
So we always say, again, I'm not born as a patient, but one thing that's going to be evident to everybody is that we're all going to be a patient one day. So let's learn how to be a patient.
Right. And just remember to listen to your body when your body's telling you something. If it's saying like, hey, achy, feeling run down and fatigued, I'm having bad headaches, I'm having abdominal pains, I'm feeling swollen, I'm feeling bloated.
Anything all that's happened, and when did it happen? Again, what was the timing of it? What were all the things that I can think of? I started drinking more coffee, got less sleep, got more stress. Start writing it down, come in with that list, so that way you can have a meaningful discussion with your provider.
Yeah. And so that's a good segue in regards to, getting a provider, maintaining a medical home, establishing care, coming in and, creating that relationship with, because, we get it like when you're in your 20s and 30s, when you're in your 20s and below, you're not thinking like, I'm going to go hang out at the doctor's or get create a relationship with a physician or primary care person or something like that. But when you start to get to be in your 30s, I mean, it's a time.
It becomes more important. Absolutely. Because this is now a time where you're like, okay, a lot of people are getting into their, young families, and they're starting that way. You want to make sure that you're finding a practice and provider that, again, same mindset as you. They are keeping up with the literature. But you want to your point, you don't want to get in and start finding a provider when it's an emergency or urgency. The first time you meet your provider should not be when, oh shit, something went wrong and I need to find somebody to take care of this. You should have, again, some baselines and some history so they can reference back. They know who you are. They know, again, the family. They know the dynamics. They have all of this backdrop. Mm-hmm. And then, because, again, that's just life. Things are going to go out of whack. And when it does, they have all this history they can refer back to. And again, if you can, like in our group, it's part of a team. So that way, if that person's not there, there's always somebody else who also knows you or has at least the ability to review the charts on a chronological basis and then go, hey, I can step in and pinch hit for your provider. And when you need something real time.
Right. And, in 30 years of practicing medicine, can't tell you how many times like we've had like patients come in and they'll be like a train wreck. And you're like, well, why didn't you come in earlier? Like, well, I was either, hey, too busy work or too busy with other things in life, or like,
and they got all their care from ERs and emergency and urgent cares and the emergency rooms and scattered all
doc in
over.
a box. Yeah.
And there's no, you're like, I can't piece this all together. They're like, oh, I had an MRI at this hospital. I know I had a CAT scan over here. I know I had an ultrasound over there. And I think I had an EKG or I had something.
Right.
And you're like trying to put it all together. It's like, get in, get consistent, build that, like you said, that medical home, get that care and get that backdrop and that folder started.
Right.
So that way when, hopefully it's a,
And it's a good time to put in a shameless plug for Epic Health. Because again, at Epic Health, we not only see the individual patient, but we can see the whole family. So like, hey, that's also a good time where like, hey, you come in and establish so that we understand and know, we get to know the whole family. And it's a good time to like get that establish that care and, get that where we understand the dynamics of the whole family, because a lot of times it isn't just the individual. It's kind of like dynamics of having to understand the whole family relationship and how that's all impacting one's health.
Our family taking care of your family, right? That's what we always talk about. Again, at this point, you're building life, right? And as you're building your life, you want to start building that infrastructure, including that resource, that go-to trusted partner in your healthcare for you and your family.
All right, everybody. And we appreciate you listening to the Naaman Brothers here at What the Health.
See you guys soon.